Hello everybody, this is Deb Albert with Lighthouse Fitness Project, and I want to talk to you a little bit about my new series. It's actually part 5 of health testing for women, and I'm talking about mammography specifically. This is the 5th part of the series. And what I want to talk about briefly tonight is having a core breast biopsy with ultrasound. So if you have to have a core breast biopsy, first of all, you should relax. It's a very, very simple procedure, and it doesn't take a long time. So I just want to tell you a little bit about what to expect. You will come to the breast center where you're going to have it done, and you will register about 15 minutes before the appointment, and you will be taken back to get changed into a cape or a gown that opens in the front, just like for the mammography and the ultrasound. And I suggest that at that point that you go to the ladies' room, get very comfortable, and do that before you're taken into the procedure room. The procedure room is the same room where usually you have your ultrasound done. There's nothing special about that. You will lay on the same stretcher, and you will be made warm with a warm blanket and made comfortable. Take your shoes off as well. And the sonographer will be working in the room with you. The sonographer, I do sonography, so I do this a lot. And we do a lot of biopsies. And you can ask me any questions you want. I'm going to confirm the side where the lump is that we're going to biopsy. I'm going to pull up images on a screen on the computer so that so that we can make sure we have the right place to biopsy. We correlate those images with the ones that we're doing at that time, and I'll rescan you at that time while you're having the biopsy, before you have the biopsy. And I will open a tray, open a lot of things that we'll use for the biopsy, and so it's a lot of strange looking things, and it'll be on a tray next to you. After we get all that done, then I'll send some images to the doc to check, and then I'll bring her in, and we will tell you a little bit more about the procedure. The doctor will, and we'll get you to sign a consent form for the procedure. And then she will ask for me to scan so that we can mark the spot with a purple marker on your skin, and that does wash off afterwards. And once that's all confirmed, then we will use an alcohol swab to clean your skin. It has an orange color, and we'll drape you with either paper or cloth drapes around the breast area. We will position you before we do that, and we'll position you so that you're comfortable, and you can, because you have to pretty much stay that way for the whole biopsy, but it doesn't take long. We may have you roll on your side, we may have you, we may turn the whole table around, but whatever happens, just know that that's all normal, and we want to get the most accurate specimen for the biopsy. So let's see, after we clean your skin off and everything, the doctor's going to, she's going to prep the biopsy device. And it makes a lot of noise. It's a very noisy little instrument. It has whirring sounds and popping sounds. And she's going to let you hear what they sound like so that you won't jump when we do the biopsy, because we want you to hold really still. And she'll show you that. And then she's going to give you some lidocaine, which is numbing medication, at the area of the biopsy. It's done with a very, very small needle. It does sting or burn a little bit at the beginning, but then after that, it dissipates and goes away, and then you'll just feel pressure and hear the noise of the biopsy device. You may not know how many that we're taking, the samples we're taking. We do it very quickly. And then after that, she takes the biopsy device out, and we put a little marker into the breast with a needle that's already set up. It's made of titanium normally, and this marker will mark the spot that we biopsied. It doesn't set off a metal detector in an airport. You don't feel it. It just marks the site of the biopsy. After that, basically you're done. You will get a Band-Aid, and then we'll send you for a gentle mammogram. The gentle mammogram is done to ensure that we indeed got the area biopsied that we wanted to. And the little marker will help us by marking the spot. It is a gentle mammogram, and it's very quick. And after that, you're finished. The biopsy results will come back in about a week. They're going to go to your doctor, and I believe they send them to you as well. But you will definitely hear from your doctor, and hopefully it'll be a benign biopsy, and you can forget about that. If it is something that has to be removed, just know that you are being proactive. It is great that you attended to this early and got the biopsy done. And if they have to remove the lump, well, that's the next step. But they may not have to. Most breast biopsies are benign. So good luck with everything. I hope this was helpful to you at all. I hope it can allay a little bit of your fear of having the biopsy. It's a very, very simple procedure. Do not worry if you have to have one. The people that do these types of things will answer all of your questions and want you to be as comfortable as possible and know what's going on. One thing I do want to say is that most breast centers do have patient advocates. They usually have a nurse that is dedicated to answering your questions. If you need a biopsy or other treatment or another test, they can point you in the right direction and explain everything, and they're great. So take advantage of that person if you do get given a card with that person's name, if you get directed to them. And then just wait for your results, and I hope you have a great outcome. And thank you for listening to this video. This is my first live, so I hope you enjoyed it and got something out of it. And you can check out the other 4 parts of the series. They're very brief, but they have a lot of good information. So get your mammograms, ladies. Talk to you later.